I'm Dana Ritchie with the American Healthcare Association and National Center for Assisted Living. I'm the Senior Director of Not-for-Profit and Constituent Services. In this role, I work very closely with our not-for-profit members, our veteran service providers, and our intellectual and developmental disability providers. In addition, a big focus for the entire association right now is the workforce crisis that the long-term care sector is facing. Across the teams at the association, everyone is very focused in on this matter. We've heard countless stories from providers about the impact that it's had on the centers and the individuals that they serve. In fact, according to the US Bureau of Labor Statistics data, over 420,000 jobs in long-term care, including in nursing homes and assisted living, were lost since the beginning of the pandemic. This workforce decline must be properly addressed by policymakers and the federal government. The association has been working on several different areas, policies, and programs to help with this crisis and to assist with moving the needle on the matter. The association has been focused in on a variety of areas relating to workforce. One in particular is this nursing staff agency price gouging matter. We have heard countless examples from providers of nursing and direct care staffing agencies charging super competitive prices to desperate long-term care centers that simply need workers. Agencies are charging double to quadruple plus of what providers can pay their staff. The staffing agency worker makes only a fraction of what the agency is charging the provider for that worker. Providers have noted that they have had little choice but to pay these exorbitant prices and hope that the agency does not poach their staff once in the building. It is also important to remember that our long-term care centers are paid through the Medicare and Medicaid program. Many of them are. And thus, that's taxpayer dollars being used for this. This price gouging is simply not sustainable for our providers in the current reimbursement system structure that we fall under. The money going to these staffing agencies is stripping facilities of funds that should be going to resident care and services. The association has been working on a few different areas to help with this matter. One, we've sent in letters to the Federal Trade Commission and the White House, the administration, to request that they use the authority to protect consumers from anti-competitive and unfair practices to investigate this activity and take swift and appropriate action to protect long-term care centers. We've sent in a few different letters, and I'm going to go over those briefly now. One, we sent in a letter in the fall directly to the Federal Trade Commission on this. In addition, the association joined a coalition effort with Advancing Excellence that also sent a letter in to the Federal Trade Commission back in December. Next, and more recently, on the Hill, on Capitol Hill, there was a House letter with close to 200 bipartisan members that sent a letter directly to the administration, to the White House, encouraging them to investigate this matter. In addition, our association, along with the American Hospital Association, sent in a joint letter to the White House also asking that these staffing agency rates be investigated. Finally, there was a long-term care coalition that the American Healthcare Association and National Center for Assisted Living led with a variety of other long-term care provider groups, also sending a letter to the White House. The Energy and Commerce Subcommittee on Commerce held a hearing recently specifically on COVID-related price gouging. During this House hearing, Representative Bobby Rush of Illinois actually brought up this matter and noted the impact that this has on health providers and those that they serve. So there has been multiple notes on the Hill around this issue, with national associations contacting the White House, contacting the Federal Trade Commission on this. And we are awaiting their response in hopes that they do take a look at this matter.